Hello and a very warm welcome to Care Transition Records, a solution approach towards seamless digital processing. My name is Elisabeth and I have the pleasure today to present you our latest findings. I'm a research assistant in computer science at the University of Applied Sciences in Augsburg, and I work together with a great team of 10 people from the University of Applied Science, as well as from the University Hospital in Augsburg. First, I want to give you a short overview of what I'm going to talk about. In the beginning, I will introduce you to the field of healthcare and the care data transfer process, short CDTP. This is followed by the state-of-the-art talking about 2 other German projects in the field. Later, I will present you our conducted methods and key findings, which is followed and closed by a presentation of a short discussion and conclusion of the study. Given the shortage of skilled nursing staff and the rising number of people in need of care, making the care process more efficient is necessary. Since many healthcare processes are paper-based, digitizing these processes seems as a promising approach, for example, for saving resources such as time and personnel. But what other problems than mentioned do we face while working in the field of care data transfer process? First of all, the CDTP is the transfer of nursing-relevant patient data between different care facilities. And focusing on that, the biggest problem is the lack of implemented standards. Unfortunately, there's no implemented standard format for care transition records, which leads to syntactic and semantic differences. There's also no standard for data exchange, even though a healthcare format such as HL7/FHIR is available. It is just still not yet implemented fully within care facilities, especially in Germany. The result is the usage of different standalone software solutions, and those are not even interoperable. Imagine different groups of people all speaking in a different language or with a very hard accent. The communication gets difficult or even impossible. Another problem is that the CTRs are not exchanged digitally, as there's no implemented solution which follows data protection as well as IT security rules. Therefore, they have to be transferred to other care facilities through the patient. A full preparation for the patient in advance is therefore very difficult for the nurse staff. So the overall process takes longer than it needs, and it is very time-consuming. Also, the creation of CTRs is very time-consuming. This is because the patient information is often stored in different source systems, for example, paper records and IT systems. A last problem is that often important information are missing in the CTRs, which the care facility actually needs. An additional inquiry is needed and costs time. As you can see, all the problems I mentioned are deeply related and need attention. In order to develop a solution to these problems, the sub-project Digitization of the Care Transition Record was launched as a part of the German CARE REGIO project. Other sub-projects within CARE REGIO focus on assistive systems, scientific monitoring and ELSI, on developing a care wiki, and a care data lake. Coming back to our sub-project, the overall aim is to digitize care transition records and to optimize as well as streamline the care data transition process, which means the transfer of nursing-relevant patient data between different care facilities should be digital in the future. For the state-of-the-art, I want to talk about 2 German projects we identified as interesting. One focused on a possible data exchange solution within ATAS TI based on HL7. HL7 is a standard for data transfer in healthcare. NTI is a telematics infrastructure and a way to safely transfer patient data to other facilities. Another project focused on a possible new interoperable CTR standard, also based on HL7. You might wonder how the problems I mentioned in the beginning are not solved yet. As these 2 projects deliver exceptional experience and information in this field, but they have not been implemented nationwide in Germany yet. This may be due to a current lack of legal regulations that prescribe a specific standard for creation and transfer of CTRs. And even if standards are prescribed in the future, implementing them will cost the care facilities money, time to implement, and time to educate their staff accordingly. Concluding, until a transfer and a CTR standard can be implemented nationwide in Germany, an interim solution is needed that still simplifies data exchange. To design a possible concept for these problems, I want to present you our conducted methods and key findings. For an expert workshop and guided interviews, we identified and categorized all possible stakeholders and divided these stakeholders into 3 groups: care, technology, as well as ethics and data protection. Within the workshop, we conducted semi-structured interviews, which had questions such as: what are the most relevant data of the care transition record? What features would be appreciated for digital transfer of care transition records? How is a care transition record transfer within TI possible? And what legal and data protection regulation must be considered? In the end, we also discussed possible solution approaches. Through 6 field observations at the University Hospital in Augsburg and 3 contextual inquiries at 1 care facility, we found out that both facilities face different interruptions while entering the CTR. This could be telephone calls, colleagues, doctors, or missing documents. The current process requires increased concentration on the part of the nurse practitioner. Also, the process is unnecessarily prolonged, especially when data is transferred manually from paper to the in-house system. At all observations, the CTR was not available until after the patient's arrival. Therefore, the nursing staff could not prepare for the patient in advance. Additionally, the nurse at the care facility entered data compared to the University Hospital in Augsburg, also within 3 text fields. This has to be taken into particular account while developing a concept for example, automatic data integration. It can be concluded that a secure digital and automatic transfer of the CTR data would have an enormous added value for the nursing staff. Administrative work would be reduced, preparatory measures for the patient's arrival could be planned, and the nurse would have more time to devote to other activities. Based on the observations at both the University Hospital in Augsburg and 1 care facility in Augsburg, the current process of the care data transfer process was modeled. We identified within this modeling which activities could be digitized, as you can see in the following with the orange lines. Tasks, for example, as viewing the documents manually as a printout, requesting missing information of the CTR, checking the relevant data for completeness, or manually entering relevant data into the in-house system could be in the future digital. Since previous named projects, as I mentioned in the state of the art, are not satisfactory in a holistic matter, our main goal is to solve the identified problems by preparing an interim solution until standards are implemented nationwide in Germany. Based on the key findings of the expert workshop and observations, the need for 2 central digital applications could be determined. On the one hand, a CTR translator service, a machine learning component with a feature such as OCR, which means optical character recognition, also data mapping, and NLP, which means natural language processing. And, on the other hand, the CTR viewer, a viewer application for visualizing CTR information. How these are integrated into a system context, I will show you in the following. A hospital nurse, as you can see on the left, can enter or edit and retrieve CTR data via the Hospital Information System, short HIS. If a patient needs to be transferred, the nurse can digitally transmit the data to the receiving facility. The data should be transferred via the TI. Both the sending and receiving facilities need an eHealth connector for this and a corresponding electronic health card. Before the CTR data is transmitted, it must be translated into a standardized HL7 format in the CTR translation service, which can be hosted in the hospital or within the TI or at the care facility. The patient data in the standard format and the original CTR are then sent from the hospital to the care facility via the TI. There are two possible scenarios for how the data can be further processed for the receiving care facility. If the facility's previously used software is HL7 compatible, the transferred data can be automatically transferred to the facility's nursing documentation system. Retrieval, recording, and subsequent processing of the data are possible immediately. If an HL7 standard is unavailable or cannot be integrated, the CTR viewer should be used, and a manual transfer of the data to the in-house system is necessary. Then it is possible to retrieve and download CTRs before the patient arrives. I hope this overview helped you to understand our main concept. For now, I would like to end the presentation with a short summary of a discussion and conclusion. Looking back at the beginning of the project, the literature research reveals identical weaknesses in the care data transfer process to those identified through the field observations and interviews we conducted. Thus, it is needed to optimize care process by digitizing care transition records, streamlining care data transfer processes, and improving care staff working conditions. We as a team agree that this goal can be best achieved with the help of a CTR translator service, which is meant to be an interim solution available as open source. The translator service should be linked to the TI as mentioned before, which brings advantages depending on the depth of integration. Whether the translator service will be hosted locally or within the TI still needs to be clarified. Furthermore, the requirements for the ML component need to be clarified as well. For example, if the service is confronted with different CTR formats. With this, I want to thank you very much for your attention, and we are looking forward to your questions later in the session.